This module will give you an overview of the Institutional Review Board, or IRB. All human research has to be reviewed and approved by the Institutional Review Board, or IRB. You may work with an IRB at your university, your institution, or there are some national IRBs too that work with bigger groups across the country. The IRB evaluates research to make sure that it's conducted ethically with the principles that are outlined in the Belmont Report, which hinge on three principles: respect for the person, beneficence, and justice. You don't need an IRB for all research, but you do need it if the research involves human subjects and there's a risk to those subjects. If you aren't sure about if you need IRB approval or not, your IRB office can help to give you some guidance and let you know. So you likely will need it when you're working with human subjects, obviously, like patients and participants, but also if you're accessing protected health information for medical records or using surveys, interviews, or maybe even reviewing patient charts, because there's a risk that you may lose some of that information, which could then harm the patients. You don't need an IRB for things like case reports, course-related activities, for educational courses, public use data sets, or when doing quality improvement projects within your department. So what do you do when you're thinking about an IRB? First, you need to figure out what your research question is and figure out if you need IRB approval. Make sure that you've completed the required training for your institutional review board, which is usually outlined on their website. They won't review your IRB application until you complete that training. And then you're going to start working on the documents required for the IRB. That includes your protocol, an informed consent form, any advertisements or materials that you're going to give to patients, and then you're going to need to have the CV or the resume for the principal investigator ready as well. So what is the protocol? The protocol is basically the plan for your research project. It includes the background, aims, the participant population, your methods, and reference lists. If you think of a research paper that you've read before in a journal, this is sort of like the introduction and the methods section. So it lets you know why this research is going to be important and then exactly how you're going to do it. So the background is like the introduction. You describe why you think this study is important and needs to be done, and you provide literature that supports the foundation for why you're doing the research. So why does this need to be addressed, and what other literature is there to support that reason? Your objectives and aims are going to explain the purpose for your study. So these are the questions that you're going to answer by doing your research. So a couple examples may be: determine the efficacy of doxycycline in the treatment of hidradenitis suppurativa as measured by the HiSCR, which is a tool that's used to measure treatment response in that disease. Or to determine the effects of wool, cotton, and polyester fabrics on disease progression in children with moderate to severe eczema. And it's really important that you develop strong objectives or aims, because this kind of dictates the whole project and what you're going to be looking at and exactly how you're going to do it. But you're going to provide more details in the rest of the protocol. You're going to think about your participant population or the data that you're going to look at. So this is what type of patients are you looking at, or participants are you looking at, or what data are you looking at? And this may include inclusion and exclusion criteria. So inclusion criteria are things that patients need to meet to be included in the study. Maybe it would be adults with moderate to severe atopic dermatitis. Exclusion criteria are things that would exclude people from the study. So it could be things like pregnancy, children, people who've been treated with a certain medication in the past, because that might skew your results. Then your methodology. This is detailed information about exactly how you're going to conduct the study. You want to include things like your method of collecting the data, any instruments or tools you're going to use to collect that data, your plan for your data analysis, which is your statistical plan. You also want to have a sample size calculation, which is also known as a power analysis. That lets you know how many participants or records or specimens you're going to need to reach statistical significance. So you don't do a study with 2 people. You're going to have to figure out how many people you need to show significant results. And of course, you're going to want to have literature citations to support your methodology. You know, there may be a publication that shows that this tool was validated to use in this disease, and that's the tool you're going to use to measure it. You really want to think hard about your methodology, because you're going to get down in the nitty-gritty details. How many times is the patient coming to clinic? How long is each visit going to be? Is there going to be follow-up afterward? every little detail about it. Your goal is that someone could read your methodology and conduct the study without you telling them what they need to do. You may need some other documents as well. If you're using a survey or conducting interviews, you're going to include that instrument so the IRB can review it and make sure it's being done ethically. As I mentioned earlier, you need the CV for the principal investigator. You may also need to include certificates of completion for the required training modules. As part of the IRB process, you're required to do some training ahead of time that teaches you about the history of ethical research and why these principles are important. And so you want to make sure you have those completed prior to submitting your IRB application. And then some studies may require additional training or other documents, so you just check with your IRB based on the type of study. Before you submit, talk to your principal investigator, who's the lead researcher on the team, about who needs to be included as key personnel, because there may be staff in the clinic or in the research office. And you want to just double check with the IRB to make sure you have the required sign-offs before submission. If it's an electronic submission, like many are nowadays, it may sort of automatically tell you if the required sign-offs are completed. And then it can take a little bit of time, so we'll talk about the IRB cycle and process in a minute. So the basic process, once you have everything ready, you submit to the IRB. The IRB committee meets and reviews applications. They'll provide feedback. If they don't approve it right away, they'll provide feedback and requested modifications or clarifications. Then you revise and submit again. Some IRBs meet monthly, some meet at different frequencies. So it's important for you to know the meeting plan and schedule for your IRB so you know what you should kind of estimate as a time to be able to turn around and resubmit. And then eventually you go through this process and you answer all their questions, clarify everything, and you get approval. So they could respond in a couple different ways. As I mentioned, approval means you're ready to go. You can start your research. You can also get approval with comments. So it might be, we've approved, but you need to make sure you do these couple things. Very commonly, before approval comes requests for revisions. So they may say you need to outline more information about exactly how you're going to protect subjects or exactly how you're going to do a part of this research. You make those revisions and resubmit, and you kind of keep doing this until you get to the approval process. And then, of course, you might get disapproved if it's not an ethical thing to do, or a denial of review if it's not necessary to be reviewed by the IRB. So there are several categories of IRB approval. Full board approval is the most rigorous. This is what you might think of for something like a clinical trial that involves a new medication for patients. So there are some real risks that people need to understand. So that's greater than a minimal risk. It needs the full IRB committee to meet and approve. And like I said, the IRB committee meets at different intervals. At our institution, it's once a month. And this takes the longest to get approved because if you need to make revisions and get feedback from the IRB, you have to make those revisions and resubmit before another meeting, wait for that meeting to happen, get more feedback for revisions, and kind of keep resubmitting. Expedited approval means there's minimal risk, and instead of going to the full board at one of their meetings, it's assigned to a designated reviewer from the IRB. So it's a little bit faster to get approved because you're not tied to that cycle of the IRB meetings. Things can happen in between meetings. And then exempt review is the fastest to get approved. This is where there's no or just no greater than minimal risk. And just a staff reviewer typically needs to check it out and give you the approval. So this may be something like a chart review where you're looking back at charts and just pulling out de-identified information. So there's no real risk to the participants. Then you might be able to apply for exempt. Your IRB website will usually list the exempt and expedited categories so you can check and see if they apply to your research. And as always, when in doubt, talk to someone from your IRB. They're usually very eager to help you navigate the process. Speaking of navigating the process, what are some resources? Check out your institution's IRB website. There's usually lots of helpful information, including the dates for their meetings and the submission deadline dates. The training that you need to do. So for our institution, it's through a website called City that you need to have training done. Educational materials for the IRB, templates for the forms, and then submission requirements. So basically all the information that you need. It usually also has listed methods to contact the IRB to get advice and guidance along the way. Then you can also access resources from other institutions' IRB. So sometimes other IRB websites will have useful information that may fill in some gaps if your institution doesn't have everything you need. And sometimes you can find things online too. We're all pretty good at doing an internet search to find what we need. And when you're getting ready to write an IRB, there's lots of tips and resources online. So in summary, you're going to need IRB approval for any human study. The application requires you to plan out your research project in detail, the background methods, instruments you'll use, dates of appointments. And then the IRB application process can take time, so it's important to account for that when you're planning ahead for your study. And quick turnaround on those revisions really helps. So if they tell you need to make changes, the faster you can get those changes made and resubmitted, the more quickly you'll be moving toward approval. Thanks very much for your time and attention. We want to make these modules as useful as possible, so we really appreciate your feedback. Any feedback you have to help us improve these and make them even more useful is greatly appreciated. Please scan the QR code for a survey that will allow you to provide us with some feedback.